DEEPIKA, Genotype and Phenotype Features in Leber's Congenital Amaurosis, Patients from Tertiary Eye Care.
Hi ma'am, this
Screen is not visible.
actually I have two presentations. This is one of them. Can I go with them? They displayed this.
Go by the sequence only.
Yeah, please change the PPT. Good morning everyone, I am DEEPIKA. I'll be presenting on genotype phenotype features in Leber congenital amaurosis patients. So I do not have any financial disclosure and none conflicts. 5% of all inherited retinal dystrophies are due to LCA and 20% of the childhood blindness is due to LCA. We all know that typically a LCA patient presents with severe affection of vision, nystagmus and eye poking. What is interesting to note is the fundus. Sometimes it can vary from normal to widespread RP changes like RP. So this is where genotyping will help to identify the disease thoroughly. The fundus phenotype varies with the affected gene and genetic variant. With 2017 US FDA approval for the FP1635 type 2 LCA gene therapy, it is very important for our patients to have genotyped before any therapy starts. So with this background, we try to evaluate the genotype phenotype features in LCA patients. The main objectives were to analyze the genetic mutations responsible for LCA, to assess the phenotype and genotype in those genes. We also tried to understand one of the challenges for the genotyping in India, that is developing countries, that is affordability for the genetic testing. This was a retrospective study of 6 years. We included only those cases who were genotypically proven by LCA and matching to the LCA clinical definition as per standard guidelines. We excluded all the cases where we found that the genotype is not matching with the clinical description which was supposed to be fitting for LCA. The method of genetic analysis was always, the genetic testing was followed by after the genetic counseling. Blood sample was collected, a genomic DNA was isolated. It was for a commercial certified genetic laboratory. Patient's exome was sequenced using NGS technology. We did a panel of tests for all the IRD genes of 195 or more. It was the genetic variants which were found in the result were confirmed by Sanger validation. These are the results. We had 35 patients. Median age at presentation was 24 months, and all the patients had symptoms at less than 1 year of age, which is matching to LCA. The major symptoms were nystagmus, poor eye contact, and eye poking. Positive family history was noted in 28%. As this is retrospective, maybe some records will be missing. History of consanguineous marriage was noted in good percentage of amount, that is 54%. The mean BCV at presentation was very low, which if we convert into a regular OPD basis, it was just hand motion appreciation to perception of light. 8 patients at presentation were unable to even fixate on the light, and this was the complaint brought by the parents. In the fundus, RP abnormalities was the major change which was seen. As we noticed, I have put 4 images. So the fundus varied from being normal to subtle RP granularities, mottling, to a frank pigmentary changes and macular atrophy with pigmentation. So the optic disc is very important because in a typical case of RP, it might be having a pallor, whereas in LCA, we found that at presentation, 50 eyes had normal optic disc. Macular involvement was noted in 17%. 14 eyes had a completely normal looking fundus at presentation. So this is the gene and the percentage of their mutations. The major 4 genes which were responsible to cause LCA in our cohort was GUCY2D, the most common one. It was followed by CRB1, followed by RPGR-IP1, and then RP65, which was the approved gene therapy one. This is in brief. The table is a little bit crowded, but I'll just, I want you to focus on 4 things which I have highlighted here. In GUCY2D gene, all the pattern of inheritance was autosomal recessive. Most common type of mutational change observed was missense variant. Just focus on the age and visual acuity column which is there. All the patients had severe affection of the vision, ranging from just fixing or following of light. and to just hand movement. 2 patients of here had normal looking fundus. The next most common was CRB1. There was little heterogeneity when compared to GUCY2, the previous table which I showed. They had this mixed pattern of inheritance, autosomal recessive, somewhere compound heterozygous, and we also noted heterozygous autosomal dominant. Here we had 2 patients who had normal looking fundus, but in spite of normal looking fundus, the vision was very low, and one child in the last column, last row, was not able to fix the light. So what I would like to infer is that despite a normal looking fundus and vision will not be able to correlate anything in LCA, it is very important to perform certain tests like ERG or genetic tests to identify them. So this is a fundus of CRB1. Important thing in CRB1 noted was they all had macular involvement with pigmentation. This is RPGR IP1. One patient had Coates disease, which was treated with focal laser and intravitreal Avastin. RP65, all the patients had pigment mottling. Briefly, I'll just end up on this slide, which is very important for our scenario. The cost of testing lowered from 25,000 to 13,000 over the period of 6 years. The median amount spent for genetic testing noted was 18,000. These are all the tests where the patient had gone or the parents have gone to the genetic testing, and it was paid by them only. So it is very important because the patient is paying the amount, and more number of testing requested led to cost reduction. That's what our assumption. Still, majority of our patients will not be able to afford this amount. It warrants active involvement or collaboration with clinicians and genetic certified laboratory to work on either narrowing the panel of genes so that the cost will be reduced, or direct cost reduction by discussion into the company. So to conclude, these were the 4 genes which are common in our LCA cohort of India, and they are very heterogeneous with severe affection of vision. Thank you.